structure, this view of the heart is likely to be out. And as I told you, you should know both on that PowerPoint and this, which is, there's a number there. Can you see that number? Anybody can read the number?
49, they're on the red one?
The red one,
49.
Yeah. 49 is the left anterior descending artery.
Left anterior descending.
It comes off of the left coronary artery. Now, left coronary artery, what number did you say that was?
49.
If you look up, you'll see 48, and that is the left coronary artery. And then it sends a branch, red, going around to the back of the heart. And of course, it doesn't have a number. But this one, right there. That's the circumferential. Excellent.
Circumflex or
Circumferential. Wait, circumflex. You're right.
Yeah.
Now, when that circumflex shows up in that back part, that's that red structure. You can see that's going to eventually go down.
Yes.
You'll also see another one going down from the other side. From the other side, that is the posterior descending branch. Now, with the veins, that's a blue structure. On the anterior side, it's going to be called the great cardiac vein. What's the first adjective?
Great.
Second adjective.
Cardiac.
And then it's a vein. Don't make up words. You people who haven't had me, what's going to happen is some of you are going to make up words. Don't do that.
Don't confirm.
Okay? Because what happens is, for some of you, you think you have it in your mind. You sit there and nod your head. And the problem is, you really don't know that material. When that great cardiac vein comes along the posterior side, it changes its name to the coronary sinus. How are we doing? Blue in front is a what?
Great cardiac vein.
In the back it's?
Coronary sinus.
Okay. You should know that the pulmonaries, the red pulmonaries here are the what?
Pulmonary veins.
And the blue?
Pulmonary arteries.
How are we doing? You should already know superior vena cava, brachiocephalic. You can see the right and left coronaries, yes or no,
Yes.
coming off of the ascending artery, aorta, and you see the brachiocephalic, the left common carotid, and the left subclavian. And then you see it going down to become the descending aorta. Remember, 1 brachiocephalic artery, 2 brachiocephalic veins. Start learning this material now. Don't wait till the last minute, because we're going to be looking at the shape part, the cat next week. Learning these names will help you on that next material. If you don't learn those names, what's going to happen is you've got more names to learn, and it's pretty soon going to look like a tossed salad. So don't get behind. Now,
Mr. Lowe, are those the only veins and arteries you want us to learn on the outside of the heart, posterior and
probably.
Probably. Okay.
Now, you can see some of the vessels here. But what I use this model for is this one right here, which is called the it's called the cephalic. And it's going to come right along here. Yeah. Yeah, that's called the cephalic. There's going to be 3 branches here. And you already saw this model, so this really shouldn't be anything new. You saw the 3 branches coming off the subclavian. Yes or no in lecture?
Yeah.
Now, that innermost one, if you remember, was called vertebra. The reason why it runs right next and actually inside the vertebrae. Who's recorder over here? You can literally see that vertebra right there.
Oh, yeah.
That red vessel. It eventually forms part of the circle of Willis that you should have seen in Biology 144 when you saw the brain. Okay, find people I don't recognize. Who did you have? Did she talk about the circle of Willis in the brain? Okay. And Dr. Thompson. Dr. Becky. Anybody have her? Okay. Circle of Willis carries blood to the brain. Carotid's here. There's a sleeper hold that the police used to use. And what you would do is take your arm around that person's neck. You're not crushing the trachea. You're putting pressure by the humerus and the ulnar radius against the carotid. You're putting that pressure, blood can't go through, and the person loses consciousness. And the martial arts are defensive tactics. You practice doing this, and you're supposed to tap on the person as soon as you get lightheaded. And people would do it on me until I passed out and said, "Mr. Lowe, you wet your pants again." Sometimes I'd pass out and I didn't want wet the pants. What they do is get a Coke and pour it on my pants. People weren't nice to me.
Not very friendly.
And those were my brother-in-laws. And there are your vertebrals. So if your carotids are blocked, you'll lose consciousness, but theoretically you won't die because of these vessels of what? Vertebrals going to the circle of Willis, keeping that whole brain alive, not up to levels of consciousness. Am I making sense? Now, so you should know on this model, what are the red ones called? On that standing model, what is going along the sides? And on top, it's called the circle of Willis. Now, next thing. Do you see the veins here?
Yes.
Okay. These are critical the low openings in that fat. Venous Did you remember me talking about this? This is sometimes called a subdural.
Oh yeah.
And I talked to my people about a subdural. That women would often be given a subdural.
Yeah.
This is called the
Epidural.
venous epidurals. This is called the venous plexus. Now this venous plexus basically is right next to the cerebrospinal fluid. And so the veins here, if they get some material, some of it will leak into the cerebrospinal fluid and will cause a general numbness in this area of the dura, and that's where you get your epidurals. Okay, so even on this model of the nervous system, we see that interrelationship of skeletal, the nervous, obviously all of the systems combined. That's why the way I teach, I try to give you a lot of stuff. You will forget some of it, but the more you're exposed to material, the better off you will be.
So just to confirm, the little, the little veins are the venous epidurals, but the whole
No, the whole, this is called the,
epidural plexus.
I'm having a senior moment. I'll get that to you.
Okay. Okay, but the individual veins
No,
are
we're
called
talking
venous
about the whole
epidurals?
network.
Okay.
It forms a plexus.
Okay.
Venous, sinus, plexus, but I think it's the word vertebrals
Okay.
in there.
Just let us know.
And here we have right now the vertebrals. Okay, now, don't worry, we're going to hit this one again. How about you hit it right now? Come on out. Come on out, wherever you are.